Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. More states ramp up measures to manage third wave of infections with provision of personal protective equipment and increased monitoring. Northeast Development Commission donates materials to fight COVID-19, asks governors of the region to collaborate in fight against the pandemic. And Japanese Prime Minister raises alarm as cases continue to rise in the country, prompting him to urge people to watch the Olympics from home. And Nigeria recorded another high this time, 558 new cases of COVID-19, with Lagos recording 376 alone. The spread of the disease also covered more states across the country's 6 geopolitical zones. A multi-sectoral National Emergency Operations Center, EOC, according to the NCDC, is still activated at level 2. However, an unofficial third wave of COVID-19 seems to be spreading, with previous records of highest daily cases rising. And this is coming as medical experts warn that Nigeria is at a risk of yearly multiple and concurrent disease outbreaks due to the tropical climate, population density, and poor socioeconomic factors.
As cases rise and the third wave takes root, the Nigeria Center for Disease Control is reminding Nigerians that the power to stop COVID-19 is in their hands, with the actions of constant hand washing and sanitizing, always coughing or sneezing into the elbow, not going out without a mask, keeping 2 meters distance between them and the next person, and staying indoors while sick. There's been another rise in the number of new cases to 558 in the last 24 hours from 535 48 hours ago. Today's cases are reported from 15 states and the FCT. The majority were recorded in Lagos with 376 cases, representing 67% of all reported cases in this 24-hour cycle. Oyo had 33, Akwa Ibom had 26, the FCT came in fourth with 22. Imo had 15 cases, while Bayelsa and Ekiti reported 13 each. Kanu had 12, while Ogun and Plateau reported 11 each. Delta State reported 9, Jigawa reported 6, Rivers and Zamfara had 4 cases each, Edo had 2, and Ebonyi had the least with 1. No cases were reported from Kaduna, Nasarawa, Ondo, and Osun states. The overall count of confirmed cases in Nigeria is now 172,821. 44 persons have been discharged in the last 24 hours, raising the total number of recoveries to 164,930. There have been 2 more deaths in the last 24 hours, increasing the fatality toll to 2,141. There are more than 5,000 active cases in the country, while over 2.4 million samples have been tested so far. Over 6.6 million confirmed cases have been reported in Africa, and more than 168,000 deaths have occurred on the continent. Globally, more than 196 million cases have been confirmed, while deaths have surpassed 4.1 million.
And donor partners have continued to support response to COVID-19 in Bauchi State, especially as the country enters the third wave of the virus. The state received personal protective equipment and other items worth 53 million naira from the Global Affairs Canada-funded Born COVID-19 project implemented by Plan International Nigeria. The donors will also establish 90 hand-washing stations in health facilities across the state.
We understand that COVID-19 is still ravaging our communities. Now we are at the verge of witnessing the third surge of COVID-19. So our modest support for the state to respond adequately to this pandemic is to help hand over the PPEs to the state. So the PPEs involves disposable face masks, about 1,512 pieces. There are rubber boots, about 216. Overall, 216. Disposable surgical gown, 2,160. sharp boxes 3,888, surgical apron 432, utility gloves 432, surgical gloves, that is latex, 648 pieces, examination gloves 648 pieces, goggles 648 pieces. In addition, we are supporting with the construction of hand washing stations in 90 90 hand washing stations in 68 PLCs and 22 general hospitals. We also are supporting the state with IEC materials, which includes banners and posters.
And the Northeast Development Commission says it is not going to lower its guard in the fight against COVID-19, especially with the new Delta variant in the zone. At an event organized to review some of the successes recorded so far in the fight, the managing director of the commission says it will continuously donate PPEs to health facilities, schools, security agencies and road transport workers to minimize the spread. The commission calls on state governors of the Northeast region to collaborate with it to effectively ensure total eradication of the pandemic in the region.
It could be recalled that at the advent of the COVID-19 pandemic, NEDC sensitized the public on the dangers of the highly contagious disease and provided food items to cushion the effect of the lockdown period. We also provided diagnostic, preventive, and therapeutic facilities, consumables, and other supplies across the Northeast zone. The Commission donated PPEs, beds, ventilators, ambulances, and donated fully equipped COVID-19 laboratory facilities to all the 6 states, as well as all federal health institutions in the zone. To support further the effort of the government of Taraba State in curbing the spread of the disease, especially the emerging variants, I am glad to inform you that NEDC is not relenting in taking relevant proactive measures in this regard. To this end, we are today donating some items to boost personal protection against COVID-19, especially among children in both private and public schools, security agencies, and National Union of Road Transport Workers, whose members commute thousands of passengers daily in the state. The item we are donating today includes 10,000 pieces of branded masks for public primary schools, 5,000 pieces of branded masks for private primary schools, 4,000 branded face masks for military and other security agencies, 5,000 branded face masks for Nigerian Union of Road Transport Workers, 1,000 cartons of associated hand sanitizers, 400 cartons of antiseptic soap, and 100 pieces of infrared thermometers for primary schools. Additionally, we will be donating over 10,000 stocks of associated essential drugs and medical consumables for primary health facility across 16 local governments in the state. It could be...
Well, Dr. Shalom Oni is a public health physician and he joins us here in Lagos. Thank you for joining us on the program.
Thank you very much, Melissa.
All right. I want to start with the NEDC, and that's the commission talking about its donation, PPEs to health workers, schools, security agencies, to sort of minimize the spread, stamp out the pandemic from the region. But I want us to also look at, the Northeast states and what they've recorded in the last couple of, this is since the pandemic began. If you take a look at the region, that's the Northeast states, Adamawa, Bauchi, Borno, Gombe, Taraba, Yobe.
That's right. You
find out that Gombe, for example, has recorded a lot more cases, over 2,000 compared to the others. Yobe, the least,
exactly.
With about 499 cases totally since the pandemic broke. But in terms of those that are on admission, Gombe still has the highest. We have Taraba and Yobe states with no cases on admission at the moment. But relatively, we've seen a region with one of the lowest cases in terms of those that have been recorded. What do you think this is, and what do you think other regions can learn from the Northeast?
Well, let me respond to the first thing. What we need right now is donations. Donation of face masks, sanitizers, face sheets, all the PPEs. So NEDC bringing our donation to the picture for me is a step in the right direction, and we need more of the private, and non-governmental organizations to start doing that, because so unfortunately we are beginning to see the rise, of COVID-19 infection in Nigeria, and it's affecting all the regions, and all the apparatus and structures that were in place in the first and second wave needs to be up and running now. So that's a step in the right direction, and we need more of that.
So do you think that perhaps states relaxed? I mean, if we take a look at Lagos now, that's recording astronomical rise in cases, do you think there was a sort of relaxation after the first and second wave?
You one time used the word fatigue, and I think maybe, for example, myself, I've been wearing face masks for the past 1 year. It's not been easy on a daily basis. So maybe fatigue setting at a point in time, but right now we all need to get our apparatus, up and running to ensure that all the structures are in place. What I mean by line listing, of patients, contact of cases, contact tracing, testing, all those has to, come up so that we can nip this third wave in the bud. But let me go back to the statistics that we have here now. If you look at these states, northeastern states, for me in the last 6 months, something is common to these states, and that's heightened insecurity. I'll be coming from that angle. Now, wherever there's heightened, you look at some of these states, there have been schools shut down, there have been mass exodus, rural urban migration, structures have been, displaced a little. So there have not been a lot of testing going on here. In fact, at the point in time, SCDC alleged that, some of the states, especially in the North Central, we're not sending reports at the right time, to Abuja. So that goes back to the issue of how well has these states been funded, to continue testing, aggressive testing. How well have these states been funded in terms of line listing, in terms of contact tracing, in terms of getting the test done and giving the result back to individuals. So these are things we want to look at there. But as far as what to learn is here, it is yet to be seen, really, because if you are not doing enough testing, what are you going to say? What about structures? How many of them have the isolation centers? That is well equipped. How many of these states, have, the testing centers, the laboratories, just like we have in Lagos. Exactly. So, and if we are not doing enough testing, you will have low figures across board in terms of cases, in terms of admission, in terms of death. It will be across board. So the more you test, now, I want to challenge the Northeastern State to test as much as Lagos. And let's see what you are going to have at the end of the day. So it's yet to be seen. For me, I think that insecurity thing has played a factor. Then the issue of funding. Nobody's talking about this. To fight pandemic, you need a lot of funds. And the funds need to get to the right set of people. Not at the top, but at the bottom. At the grassroots, the fund need to, because these are the full soldiers that get the job done. Those who are line listing. If you are not mobilizing, they're not funding their transportation, nothing's going to get done. If you are just buying big buses and you're buying all the Jeeps and all your SUVs and you are driving them at the state level, it's not going to do anything. But those who are at the grassroots, who are taking the bike, the motorcycle, taking the forms and the paper, doing the line listing, contact tracing, collecting the samples, these are the people that need the fund. And the fund is not getting to them. Your test is going to be in shambles. And once you're not testing enough, you're not going to have cases, you're not going to have a clearer picture of what you are doing in your state. So for me, that's what I want to leave there for the Northeastern states who have experienced heightened insecurity, especially in the last 6 months.
Let's come back to the epicenter as we wrap up. And, Lagos has been that epicenter since, the start of the pandemic. We had the first phase of the COVID-19 vaccinations that started with frontline workers, laboratory staff, and the response team, strategic leaders, amongst others. And we understand that, there might be a new batch coming up in the next few weeks. Moderna, I believe, this was by the Minister of State for Health. Where do you think this should go to? Have we finished that first phase of, vaccinating priority lists? Where do you think we should channel this next batch to?
Well, the next phase of vaccination, it's not, the direction is not clear yet. I don't know what NCDC is going to come up with, but we have not exhausted the list. Not everyone in the first phase have been immunized across board in Nigeria and in Lagos. No. The health workers, the elderlies, the securities, the teachers and all that. No, they have not. So also in the second phase, not everyone has been immunized. So now that we are receiving vaccines and we are about to kick off another phase, I think what is paramount here is that the government now needs to look at how many people have received the first dose, who needs to receive the second dose. That should be a priority now. Now, how many people have not yet received in the first and second phase? So I think we need to sort out all these imbalances, before we move to the next phase, the third phase. However, you can take people to the river, but you cannot force them to drink. So there has been some hesitancy as far as taking vaccine is concerned. So if you are not getting enough response from people in first and second phase, then you have to move to the third and fourth. If it is the third and fourth people that are ready, then you go for them.
Something to talk about. We always appreciate your time, Dr. Shalomoni, on the program. Thank you so much.
You're welcome.
In Ekiti State, the government says it is employing a hands-on approach to ensure healthy measures in the face of the new variant of COVID-19 and the resurgence of the monkeypox. While decentralized testing is in progress, vaccination also accorded priority, coupled with awareness and protocol compliance efforts are currently ongoing.
Our approach is three-pronged. The first is that we continue to maintain and encourage people to maintain safety protocols. Wash your hands, use sanitizer where applicable, maintain 6 feet distance, and use your face coverings. This is important because that's the first step to ensuring that we can prevent the people from having the ailment. The second, of course, is around management, right? And with management, it means that the capacity is there as a state. Well, before management is testing, right? We've expanded our ability to test across the state. We no longer test only in the capital. We test in all the 16 local governments. We've decentralized testing to primary healthcare centers by using rapid diagnostic kits. As I speak to you today, on the average, we do over 400 tests. As of yesterday, we actually did over close to 1,000 tests in the state. And the more you test, statistically, it means that you are more likely to have more cases. So we're testing significantly more. The third is around the management, which I talked about. We have 3 isolation centers in the state, and our domiciliary care is also important, so we're working on all that. And finally, of course, when we had the vaccines, which were provided by NPHCDA and the federal government, we mobilized that heavily and ensured that more than 2% of the state's population received their doses. You would always have people who may not necessarily wear that mask, and we recognize that. Our role as government is to, continue to encourage them on one hand. On the other hand, we can then enforce, which is the point you've made. Yes, you did mention that you've been across the state, but I'm also aware that you were here and you would have seen that everybody here used their mask. Radio, we're on TV, we're encouraging people, and we also have a task force, which was set up by His Excellency, Dr. John Kayode Fayemi, to ensure compliance amongst people. So we'll continue to do that.
Looking at COVID-19 and travel. This week, between the EU, the UK and the US, the latest developments have been a source of both relief and frustration. Britain has just announced it's allowing people vaccinated in the EU and US to visit without quarantine. And while it's great news for Brits in Europe and the States who haven't been able to see their family for about a year, however, there's irritation on the side of the Atlantic after the US said it wouldn't be returning the favor to the UK or the EU just yet. Well, Deutsche Welle correspondent Rob Watts from Berlin joins us now for more. Hi, Rob. What does the change in the UK's policy mean?
What is essentially happening is that the governments of Scotland, England and Wales are from now on going to recognise vaccines administered in the US and in the EU as equally valid as those that have been administered in the UK itself. And that means people arriving from those countries no longer have to self-isolate as a matter of course when they arrive in the UK, provided they have been vaccinated. And this is really good news, for example, for British people who live in the United States or in EU countries and are keen to get back and see their families. Some of them haven't seen them for a year or more. This now means that they can go back, provided they're fully vaccinated, without having to isolate when they get there. It's also good news for the British tourism sector. They've welcomed this because it means Americans and Europeans can travel to Britain and can bring their euros and their dollars and start spending them. But it hasn't been universally welcomed. For example, there are certain sectors of British society who are very concerned that this leaves the door open for other virus variants to enter into Britain and potentially cause yet another wave of the coronavirus. That's actually the concern of the Welsh government, which has approved this change and is introducing it, but it says it's only doing so because it's got this land border with England that, you know, you can just freely cross.
But Rob, France is excluded from the change. Why?
Well, I just mentioned about the worries about new virus variants, and that's actually what's behind this exception that's been made for France by the Brits. It's because of the presence of the beta variant in France, which at the time of this announcement was in the ascendancy in terms of the proportion of cases in France that were the beta variant. But the French have called this policy discriminatory because the actual number of cases of the beta variant in France are not very high at all. The only parts of France that have the beta variant as the main dominant variant are the overseas territories, places like the island of La Réunion, which is in the Indian Ocean, some 9,000 kilometres away from Paris. But the British Foreign Minister says, well, it's not about the distance, it's about the ease of travel. And La Réunion is as much a part of France as, you know, Marseille or Lyon.
So if we have the EU and the UK both allowing vaccinated Americans to visit, is the US going to return the favour?
Yes, the question that's being asked in London and in Brussels is, when will the United States reciprocate? Is particularly being asked in Brussels, it's got to be said, because the European Union dropped its requirement for Americans who've been vaccinated to go into quarantine some 5 or 6 weeks ago, immediately after a visit from President Biden. And President Biden did say to Angela Merkel when she was over in Washington a couple of weeks ago that there was a plan in place to start allowing Europeans who've been fully vaccinated to travel to the United States. But this week, that appears to have come undone, with the US government saying that there are no immediate plans anymore for that to happen because the number of cases in the United States is rising and they basically don't want to be taking any more risks. And yeah, that's got some people in Europe a bit irritated. We'll have to see how long that lasts and how long they have to wait for the United States to return the favour.
DW correspondent Rob Watts, many thanks. And Japan has widened a state of emergency in Tokyo and expanded it to new regions as it faces a surge in cases. Plus, a new COVID outbreak of the Delta variant in China is being described as the worst since Wuhan. There's more on the and other developments on our global COVID-19 update.
Japan's Prime Minister Yoshihide Suga warns that infections are spreading at an unprecedented rate, urging the country to watch the Tokyo Games from home. New cases are being fueled by the more infectious Delta variant. A state of emergency has been extended in the country. Over in China, a COVID outbreak first discovered in the Chinese city of Nanjing has spread to 5 provinces and Beijing, with state media calling it the most extensive contagion after Wuhan. Almost 200 people have been infected since the virus was first detected at the city's busy airport on July the 20th. All flights from Nanjing Airport have been suspended until August the 11th. Israel's former Prime Minister and head of the Likud party, Benjamin Netanyahu, has received a 3rd shot of coronavirus vaccine as the country kicks off a campaign to give booster doses to people aged over 60 as part of efforts to slow the spread of the highly contagious Delta variant.
I'd like to update you that the expert committee at the Ministry of Health of Israel officially approved the recommendation of giving a 3rd booster dose of the COVID vaccine to Israeli citizens above the age of 60. The decision was based on considerable research and analysis, as well as the rise in risk of the Delta variant wave.
Israel was a world leader in the vaccination rollout, and around 57% of the 9.3 million population has been double vaccinated. But daily new infections have spiked to more than 2,000, up from a handful of cases per day a few months ago, and about 160 people are currently hospitalized with severe symptoms. Speaking of vaccination, South Korea has announced the plans to expand its coronavirus vaccine rollout to people aged 18 to 49 as the country grapples with record-high daily cases driven mostly by infections in the unvaccinated younger population. Over in Europe, England's chief midwife says more pregnant women should get the vaccine as estimates suggest the majority are unvaccinated. The number of moms-to-be in hospital with the virus is rising, and while uncommon, severe illness with COVID is more likely in later pregnancy. And finally, Australia has deployed hundreds of soldiers to Sydney to help enforce a COVID lockdown. A Delta outbreak, which began in June, has produced nearly 3,000 infections and led to 9 deaths.
You to take responsibility. You can visit our website. It's channelstv.com for more updates, a better understanding of the pandemic, plus other stories. And that's the program for the week. Thank you for watching. I'm Millicent Wonka. Stay healthy.